Welcome to a discussion about concussion. I'm Geoff Lauer with the Brain Injury Alliance of Iowa, and I'm here today with Dr. Luke Spellman. Dr. Spellman is a pediatrician with the Unity Point Clinic in Cedar Rapids, Iowa, and he's also a board-certified sports medicine physician. Dr. Spellman, thank you for being with us today.
Happy to be here. Thanks
Great.
for having me.
Yeah, so today we're talking about concussion. How long do the symptoms of a concussion typically last? And does it vary depending on the age of the person?
Sure. So concussions are very different in every person, or can be very different. Typical symptoms, if you look at like statistics, about 70% of kids who sustain concussions recover within 4 weeks. About 30% of kids that sustain them, young athletes, take a little longer than that. So most kids in my that I've worked with in my practice generally recover fairly quickly, and you're usually talking just a number of weeks.
Right. So for the kids that don't recover in that few weeks, what are the different issues with them? Why does that happen?
Sure. So there's a lot of we don't knows with concussions. Again, one thing that people, a really good piece of information for people to understand is concussions act very differently in different people. So the big point to drive home is that it's probably based on the individual. If you look at studies looking at severity of initial insult to duration of symptoms, it really does not paint a very clear picture. So I would say for concussions in general, it really is just individual, and that's probably one of the biggest factor in it is that it's different for every kid.
Different for every kid.
Yeah.
Makes sense. Here in Iowa, I hear with some frequency student athletes and some parents thinking that they can have a certain number of concussions before they have to be concerned. Two questions that come up from that. Is having one concussion, does it have any impact on the risk of future or the severity of future concussions?
Sure. So there is clear information on that, and typically kids who've had one concussion or young athletes, young adults, are more susceptible to concussions in the future. So you're definitely at an increased risk once you've had a concussion.
Would the future concussion be any worse or last any longer if there was one that had happened before?
So it really varies, and that falls into that sort of we don't know why some things happen.
Sure.
But there is, I would say, an increased risk of more severe concussion. But some kids who sustain an initial concussion have a second concussion that is not that bad, but there is an increased risk that you can have more severe symptoms the second time around.
Makes sense. So if somebody either had more severe symptoms or was in that group that didn't recover within that typical period of time, what kind of treatment or care do you suggest or direct parents to do?
Sure. So with the more severe or prolonged symptoms with certain concussions, it really becomes a team approach. Again, fortunately, most athletes, non-athletes, kids or young adults who have concussions do recover fully within a matter of weeks. But with the prolonged types of concussions, the post-concussion symptom type presentations, or post-concussion type presentations, that becomes really a team approach where you're looking at working in close continuity with school, with other specialists, whether it be your pediatrician, sports medicine, neurology, physical therapy, and really working in close proximity with the school system, school nurse, someone who may be designated, and watching the kid closely at school, and you're making accommodations to try to maximize that kid's ability in the situation they're in.
So that makes sense. So that'd probably be the case in terms of even that first few weeks for a typical concussion recovery, is that communication with the schools now, at least in Iowa, based on recent legislative changes that focus on return to learn, and that the process of getting kids back in to the school as soon as possible. How do you navigate that kind of communication, or how do you suggest that parents connect between their healthcare professional and the school?
Sure. Well, I think just being available as a healthcare professional, typically how I've generally practiced is there's usually a list of accommodations that you can talk with parents about. And really a lot of those accommodations are driven in the school setting. Iowa's doing a very good job, and the education in Iowa is great. There's a lot of good information, handouts, and the schools are becoming very aware of how to help these kids with concussions. I think open communication, we typically see these, if it's a kid that has a concussion, we see them for a few minutes in the office, maybe up to an hour. And then a majority of the time they're being monitored by parents and then at school. So I think it's just really a group effort, and then open communication, and then having the school officials feel comfortable to be able to talk to the healthcare professional.
Good.
And just, that's a big thing.
So not that long ago, there was a belief, and it may have come out of healthcare, that after a concussion there were specific things that parents should do. For example, wake their children up every hour over the course of a night. I don't think we do that anymore, but are there things that would trigger a parent to be concerned in the first few days or few weeks after concussion that they should seek relatively short order care for?
Sure. So you're correct in that. The general recommendation now is to let kids get what they need, which is rest. So I talk to parents that are very nervous. I said, you can always check on them, make sure they look comfortable, they're doing okay. But really letting them sleep is one of the main components of treatment of concussion.
Okay.
And as far as in regard to things to watch for, there's definitely things you watch for. And we typically talk about a list. The list generally includes more significant or worsening symptoms. So a few examples would be, more acute changes in like consciousness, recurrent vomiting, worsening headache, not sleeping at all or sleeping too much. I really talk to parents about, if you think about something extreme and it's becoming extreme, a healthcare professional should be notified and kids should be reevaluated.
Makes sense. So in terms of student athletes, there's often a shift, well, there has been a shift in the history of concussion where we've used to say, oh, you just got your bell rung and, pull yourself back up, get in the game. When are you, or when should healthcare professionals be signing somebody off to go back into play or intense physical activity? What are the things you look for to let people back into the game?
Sure. So you look at a combination of things. Really, initially, you want that mental and physical rest period. Again, if you look at the studies, you look at the most recent recommendations, complete rest, not doing anything for multiple days, actually may have a negative impact on kids. You try to get these kids back to the sort of their daily activities, get them back into the school setting, and then monitor them closely. As far as a return to play, it's not just simple, you can go back. It's not just you can go back in 1 week or 2 weeks.
Okay.
Those are the old ways that we did things, and really the up-to-date ways to do them are to watch those kids, watch their symptoms decrease, and then do a gradual return to play.
Okay.
And really it's a multi-step approach with increasing activity from a mild to strenuous activity, and then if it's a contact sport, getting them into practice, then collision before you fully return to game.
Is it ever the case that you find that after having a kid or a child go back to play, that it may have been too soon and that you'd have to take a step back?
Unfortunately, that happens sometimes. I think in general, we're doing a pretty darn good job of getting these kids safely back.
Great.
But when I talk to parents and I talk to coaches, I talk to school officials, I tell them if symptoms come back, it's too soon.
Okay.
So really, in general, like life, a lot of things are common sense. If something bad comes back, you step back and you really sort of put on the brakes with those kids.
And that'd be if a parent were to see that, for example, a kid coming back at the end of the day, just more wiped out, more tired, woozy, complaining of headache, that might be a time to talk to their healthcare professional and perhaps the school again.
Absolutely.
Okay.
And it's very common for a kid to have or young athlete to have the concussion occur like on a Friday night.
Right.
They feel great through the weekend. They maybe don't talk to a healthcare professional, and they get into school on Monday, and that cognitive thinking, that mental stress that occurs at school brings back symptoms.
Interesting.
So, yeah.
So it might be that a concussion isn't immediately recognized, and that it might be some period of time, a day, a couple of days, before the red flag would go up that, hey, something might have happened on Friday.
It's fairly common, actually.
It is.
And usually, fortunately, like in the state of Iowa, and then where I trained in the state of Ohio, we had very good sideline team members, like the athletic trainers. They were monitoring these kids and were aware of the situations. But especially with the younger population, when you don't have an athletic trainer in the sideline, you don't see an impact or a direct insult to the head.
Right.
Those concussions typically creep up after observation for a few days, and we typically get those kids in the office multiple days after.
Multiple days after.
Yeah.
Thank you.
Yeah.
Well, this has been very helpful. Anything else that you would say in terms of big changes that strike you over the last few years that really are a different way of engaging concussion? Big changes that you've seen that parents might want to be aware of?
Sure. So first of all, I'd just like to give a lot of credit to state of Iowa and also where I trained too. I think the education's getting out there, and in my career, I've been doing this since around 2010. The parents are becoming more educated, coaches are becoming more educated. I think the schools are doing a good job too. I think the team effort's much better, and I think we're going the right way with concussions. In regard to as far as if you're looking at changes, the last concussion conference came out. Really, the majority of the treatment stayed the same, but they are making putting a little more emphasis on getting kids back to moving to some general activities sooner. And I think there's I think it should be pointed out there's a fine line, and there's a good place where you can get them hopefully moving somewhat, but also restricting them a little bit, just letting them rest and mentally and physically. But you can over rest in some cases. So that was one of the big components where they tried to emphasize maybe thinking about altering those recommendations.
More activity sooner. And so, thank you again for coming and talking with us this morning. Geoff Lauer with the Brain Injury Alliance of Iowa. We've been talking about concussion with Dr. Luke Spellman, a pediatrician with Unity Point in Cedar Rapids. Thanks to Unity Point for their support. And you can find more out about concussion in Iowa at iowaconcussion.org. iowaconcussion.org.